about the washing, actually, we did a study um, between one eye washing and the other eye. We just left it like that. What sir did, absolutely not much difference. But if you want that wow factor, one single wash give you the wow factor. One single wash will give you the wow
It it
factor,
it won't make
because
a
of I've
difference.
been doing and training a lot of people, and also it gave make little bit. Of course, when you take out sometimes, if your any of your assistant give the dissector with some foreign body or some fiber inside or some debris, you can take it out. That's
Can you
what
get little hydration when you put a wash inside?
no,
I
no,
mean,
one
see, if you
single
want a
wash will
wow
be good.
factor, the only thing is a good docking without any black spots, a good cut with the optimal energy, and a good split without much fooling around. And I don't remove in the middle first. I go to the side. I go from side all the way across in one sweep. So whatever videos they showed, they're very good surgeons. But my way is different. There's so many ways you can skin the cat. So which is the right way depends on the cat which you're handling. If it's a tomcat, it'll scratch you back. So don't foot on in the center because that's the optical zone. So I go to the side with, I don't use a flat one. I use the one with a thin, longer one, and I go all the way across one, and the second one I go inside and again all the way across. And I think it works wonderfully well. Yeah,
Yes, you're right.
perfect. So at the end of the day, I think I'll prefer that machine because it gives me 80 microns. I'm doing all my 80 microns, and 80 microns. How is it helping me now? Because my anterior cornea is the strongest cornea. So if I can save, so all my patients which are actually going for ICLs because they're -7 or -8, and we have cornea say about a 520 also. So with 80 micron, my PTA is coming less than 40. So because that those 20, 40 microns, if they bring the patient from the intraocular surgery to the extraocular surgery, why not?
So Dr. Yogisha sir wanted me to talk my second talk. So this is what are the complications can happen during the smile. Already Dr. Payal has spoke, but just this is my financial disclosure. So first complication, I think probably what Dr. Sonu was consistently telling about the suction loss. What might be the real reason for suction loss? It might be machine related, as he said that long suction time, that is around 25 to 28 seconds, or mismatch between the contact lens and the patient wide to wide diameter. Sometimes it might be surgeon related due to the improper docking. So the other small causes for suction loss, if we can take about, one is like mechanical factors like tight speculum, improper application of the surgical drape. Coming to the anatomical factor, suction loss sometimes can happen with the patient with a very narrow palpebral fissure, deep socket, too dry or too wet cornea, or patient with a very poor fixation. So, and even it can happen in the anxious patients also, and patient who has got a nature of frequent blinking. So, this small video about suction loss, there is some amount of already black spots happen. Then you could be able to see from the side already fluid is gushing in. Then suction loss happened. So how to manage it? Not to become panic. Immediately you can redock, then clear the contact lens, then machine will do the treatment in the same plane. So just to tell you that suction loss in the first during the lenticle cut, you can convert into the femtolasing in that moment. You can finish up the cases. Femtolasing happen during the other procedure. So this can happen, not to become panic. I think me, Dr. Anand, been doing smile for a very long period. We never got any complication. Uh, 10 years. You can come out with a very simple dissection. Wherever it is adhering, you can go with the micro forceps. Try to peel it away from the incision towards the 6 o'clock. You can take out very easily this lenticule. So there are other complications I'll be just showing you. One is cap tear and the side cut care. Somewhere if you plan for a very small incision site, sudden patient if you move while doing the dissection, this can happen sometime with the bulky surgical instrument. I'll just show you one small complication with a cap cut. You could be able to see here there are already black spot happen. So during the lenticle cut is about the cap cut. So while doing the, because patient was also little uncooperative, so the primary dissection over, though he want to take out the lenticle, he could able to see how the cap has cut at the wound. So in such cases, not to become panic, actually you can put the contact lens, still you can, the patient will have a good vision later on. This is with the side cut. So you could able to see the treatment is done perfectly by the machine. 4 mm incision. Still, it was all my learning students video. I took it from the machine. So while taking out this with the micro forceps, when you're going taking out this lenticule while doing the reverse, you could able to see there is a small side cut happen. Not to become panic, I think you can put the bandage contact lens and complete the procedure. So in conclusion, LASIK to SMILE, definitely transition is associated with some intraoperative complication. You have to prepare for that. Optimal laser sitting and proper surgical technique help to minimize the complication. Thank you, Ananda.